So since COVID, mental health has had a huge impact on young people. It became a big issue and it really impacted their lives. So we would like to know is there any provision within the budget to support that young people?
Yes, absolutely, and we know how important it is. I expect you're aware, but the organisation called Health Watch, which is a group of volunteers who look at health services across the borough, before COVID hit, they'd actually done some research on 9 to 11-year-olds, so young people in the borough in primary school. Then, of course, we had COVID, so they've done it again, and it means they have a baseline, so they can go back and look at the responses that they got in the survey before COVID and how much things have changed now. And if you go on Health Watch Sutton's website, I really would recommend it. It is absolutely staggering and shocking and really quite scary to see just how much young people are struggling. The impact of COVID and the lockdown, I think, has had far more of an impact on young people than it has on people of my age. And that's because 2 or 3 years when you are, I'm not talking about you, but if you're 6 or 7, that's a big chunk of your life, isn't it? So I do think it's had a huge impact, and we need to think about how we can do more to help young people, not just when they're in crisis, but early on. Something I feel really passionately about is that I want to help people early and do more preventative services, early intervention services, so they get the support that they need before they end up in crisis. Because that's better for the person themselves, it's better for their families, it's better for society, and yes, it's also better for the public purse. If we can give support to young people, I've been told so often the first 1,000 days of a child's life is just so important. If we can ensure that people are getting the support that they need early on, it means that they will be able to lead better lives, have more opportunities, be more balanced adults, and as a result they won't need some of those very expensive acute services. And it's not about the money, it's about ensuring that people are able to fulfil their potential and live good lives. It's as true for older people as it is for younger people. It's a battle I'm having all the time with the NHS. It's fantastic we have doctors and nurses in our hospitals doing wonderful work, but how much more would it help the NHS if we could spend just a bit more money giving people more support before they needed to go into hospital? So the whole discussion about prevention is really important. The problem is it's quite difficult to put a cost, a value on stopping something bad happening. And so when I'm talking to the police about how we can prevent crime by intervening earlier, when I'm talking to the NHS about how we can prevent people needing to go into hospital, they all agree it's important, but the budgets are all focused at the crisis end of the problem. And I think as a country we need to start shifting the dial and thinking about how we can give people support earlier and better so they don't need some of that crisis care that sadly so many people need. Having said that, if there are young people listening, we have a fantastic service called Q10, which is specifically for young people who are struggling with their mental health, and I'd really recommend any young person who is struggling to go and talk to them. We also have mental health counsellors in all of our secondary schools and some of our primary schools, and they're there specifically, not counsellors, but people who are helping them for counselling to help young people who are struggling with their mental health. But it's not nearly enough, I know, and we need to be doing so much more.